The beautiful paradise between New Guinea and mainland Australia, our island home, the Torres Strait, Place Blayumi. But there is some trouble in paradise. We have a problem. Something is breeding in our own backyards. Something that can make you very sick. Something we can all help stop. The dreaded dengue mosquito.
Ouch. Ouch. Ouch.
Dengue is a big problem in the Torres Strait. We can stop dengue fever spreading to our community. First of all, I believe that we should get community educated. There must be a community education program. If you look now, that's where all mosquito breed. Them dengue and JE mosquito. That's the only breed. If we got them kind of thing, you find them in the house. So when you find them kind of thing, make sure you tip them out. All right? When you look them thing in the house, you play. I wonder you kiss them or tell them mommy and daddy you play. We have to suck the water outside. Mumbai mosquito will come and go breathe inside and go spread around. Now when they bite you will feel sick, all right? So when you find them kind of thing, make sure you tip them out, all right?
So empty out all those containers with water from your backyard, because that way he likes to breed the most. If you take away the breeding place, Emgo can't breed and spread the disease. Remember, dengue mosquito doesn't live long and can't fly very far. Wow, very important for you to get rid of them in your own backyard.
Kill the mosquito, stop the dengue, Los Angeles.
Queensland Health often send a special team to Torres Strait, and you might see them in your own backyard. So don't worry, them will help you stop the dengue mosquito.
The Aedes albopictus Victus Eradication Program is jointly funded by the Commonwealth Department of Health and Agent and Queensland Health. We visit the Torres Strait Island communities to undertake mosquito control measures. Primarily it's aimed at eliminating a mosquito, the Tiger Asia mosquito, which can transmit dengue fever and is relatively new in the Torres Straits, but at the same time we're eliminating Aedes aegypti, which has been here for some time and has been responsible for outbreaks of dengue fever. The program is based around visiting the communities and checking every premises, every house, public building and the bush areas around the community to find where the mosquitoes are breeding, and then we use some insecticides to stop the breeding.
This work we make do house to house yard inspection. People look for mosquito. People try to kill them by destroying the breeding sites. They look like the first instance. Yeah, we might have to grow them.
The chemicals that we use, or the insecticides that we're using, certainly it's not harmful to human beings. But when the mosquito ingests this in as a mosquito larvae, there's a hormone in the compound which prevents the mosquito larvae from developing through to an adult. And even if it does develop to an adult, it's so weak and deformed that it doesn't survive.
This job for try and wipe out this mosquito. Another mosquito that can transmit dengue. This thing is properly important for Jumpla because recently we got outbreak of dengue. This one is only job MIPLA or Queensland Health vector control officers for wipe out this mosquito. The job Jumpla everybody. We all have to put Jumpla on together for wipe out this mosquito. And Jumpla go keep Torres Strait dengue free.
Okay. Part of the curriculum for the primary school students in grade 7 will be a subject called mosquito-borne diseases, and they will look at dengue fever and malaria and Japanese encephalitis, and then they will also be asking the children to research things that they can do in their community to stop mosquitoes and stop those diseases. The Asian tiger mosquito is another vector of dengue fever. As well as that, it transmits, or has been shown to transmit another 21 viruses in the laboratory. So any new mosquito is obviously a threat. So whilst initially we're trying to destroy it in the Torres Strait Islands, we certainly want to prevent it from spreading from those islands now, and there's about 12 islands that we know that it's on. We're trying to prevent it from spreading to other islands and thus reduce the risk of having these outbreaks of dengue fever. The community really needs to take possession of this issue themselves, and hopefully we're working with community councils and encouraging them to also undertake clean-up programs and that which will eliminate some of the mosquito breeding sites.
People need help from the community too. Everybody have to play their part.
The major focus of the program has been the insecticide control and visiting the communities, but two other aspects of the program are health education or health promotion, in which we're trying to create awareness in the communities about the tiger mosquito, the Aedes aegypti and dengue fever in general.
Dengue fever is not a nice thing to get. It can make you very sick and also some instances cause death.
Well, I think dengue mosquito really affect the kids especially. They get really sick, like with headaches and fever, and they like muscle aches, and they can't eat. Sometimes they vomit of high temperature, and they got pain behind the back of the eyes. It can be fatal. Because we had the death of one Torres Strait member, and that really scared the people, and it's better to them to like empty whatever holds water in their backyards. That will stop the breeding site of mosquito, dengue mosquito, and also to use repellent more often.
Dengue fever can make you very sick, especially young and very elderly people.
Our community was one of the communities that everybody felt that effects of dengue fever. And it's one thing that, it's awareness that that for all communities, not only here in Torres Strait, but on the mainland Australia, wherever, keeping our place clean. That's part of keeping that mosquito disease away from your community. Keeping your island beautiful too at the same time. You take that prevention measure and deal with it straight away. We have many movements of people here in this region anyway, Torres Strait. Movements of traditional people, commercial people. So versa versa, whether you come from the mainland Australia or mainland PNG, the movement can occur from aircraft, vessels, dinghies, people travelling by dinghies.
When people travels in and out of Torres Strait, sometimes they accidentally carry in dengue fever in their blood. The virus gets passed on to Yupla when the mosquito bites and pass blood from one person to another, then another till we have an outbreak of dengue fever in the Torres Strait. And we don't want that where Ples Ployumi.
I think cooperation with everybody, all agencies, community people, the more you educate people about mosquitoes or dengue fever, the better the control measure will be in your communities and in this region.
We believe ourselves we can do it because this is our country. We can get rid of the mosquito if the laziness is killing us. Family, let's work together, build our beautiful country between the two big nations, Australia and Papua New Guinea. We know we can do it.
Working together, we can stop dengue fever in the Torres Strait.
Together we can stop dengue in the Torres Strait.
Working together, we can stop dengue in the Torres Strait.
Working together, we can stop dengue in the Torres Strait. You listen me or what?
Everybody, Yumpla together, go killing mosquito, Yalo Zenatkes. Easy. That's it. Okay, next one. Another one now. That's it. Next. We're gonna tip the water and kill the mozzie. Now we're gonna kill the mozzie. Alright? We're gonna kill the mozzie? Yes, let's go. 1, 2, 3, go. Kill the mozzie.
Spreading from them to mosquitoes.
And by working together, we can stop the dengue mosquito in the Torres Strait.
Visiting our islands and the NPA. Eradication program is underway to wipe out the Asian tiger tail. Eradication program is underway to wipe out the Asian tiger tail. To wipe out the Asian tiger tail. To wipe out